I'm Rachel Kaiser. I'm at the Research Support Unit. So I'm very excited to present today about the supports that are available through CRIM and through the Research Support Unit. And I really want to make sure that this is relevant to the kind of work that you are potentially doing or hope to be doing. So throughout, you can put your questions in the chat, like Liz mentioned. I'll try to keep an eye on it, and if there's something that is relevant to what I'm talking about immediately, I can sort of touch on that while I'm presenting. Otherwise, like Liz said, we can have questions at the end. So thank you very much for joining us today. And so what we're going to be talking about is sort of the practical supports that the unit can provide, but then also the wonderful opportunities to engage with patients about research throughout the whole life cycle of a project. So from the very beginnings of ideas all the way to the end where all of your data has been collected, it's been analyzed, and you are now trying to do some knowledge translation or making sure that what you've learned throughout your research is getting to the folks who need to know that information, be that patients or healthcare practitioners or community members or policymakers. So that is what we're going to be doing today, and I will keep on going here. All right. So as Liz mentioned, we have a few objectives that we're hoping that you folks get from today's presentation.
What I want to say is there's lots of support out there. We are here to help. Both Rachel and I can answer questions today, but also you can reach out to us at any point and really get the help that you need on your specific project. So Rachel, do you want to start by talking about research?
Yes, absolutely. Thanks, Carrie. So because I'm aware that not everybody is necessarily doing their own research or has done their research in the past. So when we're talking about research, there's tons of definitions out there, but essentially we're just talking about the systematic investigation to establish new facts or come to new conclusions. So to answer a question, typically something that's in your field or something that's important to your patients and the folks that you're working with. Research is notorious for a ton of acronyms. So if you hear me use an acronym, please, you can put up your virtual hand or something, and that will be a clue for me to sort of scale back my language. But two acronyms that I'll just explain right off the bat is CRIM. So that is the Children's Hospital Research Institute of Manitoba. So that is the organization that houses the RSU, as well as a number of other research groups and labs and things like that. So we are based in the Brody building, so in the John Buehler Research Center. So we're sort of attached to the U of M at the Bannatyne campus, and also very close to the hospital and not too far from SSCY. So it's a really great location for us. And so there are bench researchers, there are clinical researchers, there are qualitative researchers, there are folks doing all different kinds of research at CRIM. Our focus at CRIM is pediatric, although pediatric in sort of the broadest sense of the term. So it is maternal, infant, child, youth focused. So we're sort of taking a developmental origins approach where recognizing that there are determinants of health that moms and families, even before conception, all the way through to the child becoming an adult. So that's our focus at CRIM. And then the other acronym is the RSU, or the Research Support Unit. So we are a department within CRIM. We are really aimed at being a practical service to researchers in the environment. And when I say in the environment, I mean people whose research is pediatric focused, as I mentioned, and who are CRIM researchers. Don't worry if you're not a member of CRIM yet. It is really as simple as filling out an intake. And that is just like the one step that you need to take in order for the Research Support Unit to provide you a lot of practical support. However, regardless of whether you want to fill in your intake or not, regardless of whether or not you're a CRIM member, we will absolutely help as much as we can. If you have questions or you're not sure where to go, don't let that little piece of administrative work hold you back.
Thank you. And I know when many people think of research, they sort of think of people in lab coats and microscopes and things like that. And yes, that type of research, that bench science is part of the work, but I really encourage you to think outside of the box. So the very first research project that I was involved with, it was about researching if it was beneficial to have a coach call you and support your family for 12 sessions after your preschool age child was referred to a specialist because of some sort of developmental concern. So this is what happened to me. I was referred and we waited for almost a year before we even got a phone call to make an appointment. So in that year, I'm sitting there going, did I cause this? Am I a bad parent? Like, why isn't my child developing properly? What do I do now? A year in which every day I wish I knew how to really help my child, but I had no guidance. So this research project looks to change that. The coach goes through a series of sessions on supporting their development, encouraging play, encouraging enjoying your child, and some of the specialists and therapists that might be involved in your child's care. And with the data from this research, they hope to prove that families who are supported at this time during their time on the wait list end up more resilient and better prepared. We just started, or we're just getting to the data analysis part of this project, but I imagine the outcomes will be quite clear. Not surprisingly, as I'm sure most of you might agree, I think this makes kind of sense, but it's hard to get people to spend money without data. So we are looking to provide that data. Another research project I'm working on is on measuring connections between researchers, clinicians, and families so that we can find a way to get evidence-based practice or evidence-based research into your practice or others' practices a lot faster. So yes, there are lots of labs and microscopes, but there is a lot more going on inside and outside the research box.
Thanks, Carrie. So given the whole breadth of research that's out there, all the different types, it might be confusing about where the RSU could sort of fit in. So we're going to sort of take you through the typical life cycle of a research project and explain how the services at the RSU and in particular patient engagement can be woven throughout your project. So everything from when you're asking the research question and you're really drilling down to what is it that needs, what information are we looking for to answer our question, to all the applications that you may need and the approvals that you may need to get this project underway, to actually the exciting stage of recruiting potential participants and gathering the data that you're looking for, and then analyzing your results and translating that knowledge and looping back around to the beginning, because of course, research always yields more questions. So we are here to help. The research world is getting increasingly more convoluted, especially in the age of COVID-19. Connecting with participants in person is more difficult. Engaging with partners can be a little tricky. Navigating all the sort of regulatory approvals that you need for your research. And then on top of that, all the now logistical and public health approvals that you need in order to do research can be very overwhelming. But don't worry, we make it our business to sort of figure out how to navigate that. And we are absolutely here to help to make sure that you can proceed with your project. So when we are in the pre-grant stage, so you have this idea, you want to understand more about this issue that you are facing and you would love some answers. You're identifying the problem. You are designing your project. You might be keeping an eye out for potential funders or grant applications that you could be applying for. So during this stage, it can be tricky to know how to design your research and what's even possible. So at the RSU, we have a medical director and we have a clinical trials director. So don't let the director title throw you off. So our medical director is a pediatric endocrinologist who does quite a bit of her own research. So her name is Dr. Brandy Wicklow. So she is available to folks who are just starting their research in terms of making sure that their research question and what they want to do is going to be feasible and medically sound, and actually get to the answers that they're looking for. Our clinical trials director, her name is Dr. Lauren Kelly. So she specializes in clinical trial design. And even though your research might not be a clinical trial, her background in methods can really be a very helpful support for folks who are looking to start designing their own project. So those are two supports that you can email me and I can connect you to those folks and they can help you ensure that all the work that you're going to undertake actually gets you the answers and the data that you're looking for. Not necessarily the answer that you thought it was, but at least so that the data can yield some interesting facts about it. I'll just say that. We also do some study feasibility work. We help with budget development. We can help with, if you're working with somebody with another site or something like that, negotiating a budget. We can help with account setup and with patient engagement, which I won't get too far into. That'll be Carrie's world. But these are all like so a study needs to be well designed in order to answer the questions, but without all those other pieces, the logistical pieces, the money, and those collaborations with other sites, things can fall apart no matter how helpful the research would have been. So we are there to make sure that those practical considerations are there from the beginning, so that your work can go all the way through to the end. So a study feasibility review, so we offer that at the research support unit, and it's just designed to make sure that your work is well designed. It's going to answer the question that you're asking. It's got all those pieces in place that's going to make it successful, and that it's important to child health. Because at the end of the day, that is really the goal here, is to improve child health. And so it's very easy for researchers to have this wonderful idea, and it's really good, and it's going to answer questions, but we get the research world can support some tunnel vision. So this is just a check to make sure that things are moving in the right direction.
Thank you, Rachel. So let's talk about patient engagement. So first of all, let's talk about what it actually is. So in this case, when we're talking about child health, it is meaningful and active collaboration with families with lived experience. So this might be parents, the children themselves, or youth as partners in the research. So interestingly enough, many of you might be much more familiar with that concept of sort of bringing families into your work than some researchers are, because of the models of family-centered care many of you use already in your practices. And just so you know, there's many different levels of patient engagement, and not every project has to use all those different levels. And sometimes, and what we really mean is that patients with lived experience are they're part of the project, they're consulted, and they are heard. And that doesn't mean to say that you have to implement everything they say, but just like you would with another colleague, if you are unable to implement their suggestions, then you just want to make sure that you explain why. So let's talk about a few words that are really important in patient engagement, because in this case, the words and role differentiation are really important. So let's begin with participants. Most people involved in any kind of research would know a bit about participants. These are the people who consent to have their data in the study and have that data collected. It might be interview data or survey data, biological data, social data, really any kind of data. Your relationship with participants are governed by research ethics boards and by consent documents that they have signed. And I know some projects like bench science don't have participants in that sense of the word. They may only be using mice or cells. But regardless of whether you have participants or not, you should consider having partners. So those people with lived experience who join you as part of that research team. Now, they don't sign consent forms. They're not governed by the research ethics boards. And in most cases, they are not participants in your study. Matt Murray from the Alzheimer's Society explains that one basic science research project in dementia has included from the onset 3 Alzheimer's Research Network volunteers who suggested a clear and understandable project title, and through dialogue and questioning, encouraged the researchers to think about how they can improve their experiments. So this is having patients in there right from the beginning. And so for some researchers, probably not as much for your group, but for some researchers that can be a little bit different and scary. So I always just like to remind people that patient partners or research colleagues who happen to have lived experience, you know, we aren't different or complicated really, but sometimes our lives are different and complicated because of a particular disease or circumstances. So now that we know what patient engagement is, we'll move on to what are those supports in the pre-grant period before you really have money. So the first support is me. So I'm the new patient engagement coordinator at CRIM. I started in November. It feels like a long time and a really short time ago. And well, I don't know exactly why they chose to hire me. I do know what I bring to the table. So I grew up on a farm in northern BC, and I have a lot of stories about headless chickens. Okay, not relevant. Just making sure you're still paying attention. Although it is true, I did grow up in northern BC. I have a lot of stories about chickens, and some of them are headless. But anyway, I completed a degree in theater, and I've worked as a puppeteer, playwright, and educator for young people for most of my life, which is a weird resume for a research institute, I know. So how did I get involved in research? Well, I had kids and someone asked. It was that simple. And the project was important. It was that coaching project. It was something I understood could have made a huge difference in my life if it had been available. And my hope is that it will make a huge difference in families' lives moving forward. And the team was great, so I joined another one. In January of 2019, I was hired by the Child Bite Research Network to be their parent liaison. So in this role, my job was to connect with parents and talk about their lives, their research project, and their involvement in the research network community. This is a Canadian-wide network. And so I've spent the last 2 years really learning what's important to parents when engaging in research. So I don't really have an education in how to do research exactly, but I do know a lot about what works and what doesn't in patient engagement. And I've been involved in a lot of research projects, about 10 and counting so far. So now back to my kids. My husband and I have 3 lovely daughters, age 6, 9, and 13. My 9-year-old's name is Alejandra, but we all call her Ale. She loves music and hugs, and currently Doc McStuffins. I could sing you all the songs if you really wanted to hear them this morning. And some of you may know her, and even more of you have probably seen her around the building. When we could be in the building, she was there a lot. She has a profound intellectual disability and a seizure disorder with Todd's paresis. We're pretty sure she has some sort of apraxia and aphasia as well, but she doesn't have enough language to test for that kind of stuff yet. And some of you may not understand what each of those words mean, but I can tell you in detail how each of that translates into her life, my life, and the lives of her 2 sisters. My 13-year-old Emma, for example, is very well aware of that difference. She knows what to say, and she prepares her friends very well before they come over, and she's decided not to be friends with certain people. My 6-year-old Isabel is just starting to understand that other families don't have children with disabilities. And watching her try to figure out why some children in her class just cannot grasp the concept of someone being so different from them, when for her, that is just her everyday normal life. My youngest describes Ale to her friends like this. Ale's brain is different. Her brain has some difficulties, and that's why we sometimes can't really understand her, and sometimes she can't really understand us. Yep, that's my 6-year-old. So profound intellectual disability means she cannot put on her own clothes or shoes, even though she's 9. It means that my 6-year-old knows how to keep an eye on her older sister so she can yell at me if anything happens while I run to the bathroom. And it means that when my husband and I plan for our retirement, we need enough space and money for 3 people if we can still manage Ale's care. Todd's paresis means that every time she has a major seizure episode, the emergency doctor wants to give her spinal, which we have to fight against. I can also talk to you about the cycle of grief. One particular hard week, a friend was trying to make me feel better and said, "Don't worry, it will get better as they get older." And I burst into tears because the reason it was hard that week was because I was having trouble lifting my daughter. And her getting older was not going to make that better. It was going to make it worse. And my friend had no way to know that that particular comment, which would comfort most parents, was going to get that reaction from me. She was really trying to comfort me. But I can also tell you about the absolute joy. For example, when she got her new adapted bike, they asked her what color she wanted, and she couldn't really tell us in words, so we showed her different colored circles, and she pointed to purple. When it arrived and she got on it, the joy on her face as she biked away down the street. And she has the most beautiful laugh. A quote from my 13-year-old when she spoke at the UN Convention on the Rights of the Child: "Because Ale is in my life, I am more responsible, more empathetic, and certainly more patient than my friends. Ale is a gift to our whole family, and we appreciate and celebrate her for who she is." So what does all of that have to do with your research? Well, I don't know exactly, but know this. I don't come from a research world. I come from the world of a caregiver of a child with significant differences. I have been involved in a bunch of research projects as a partner and talked with many parents across the country about how they want to be engaged. So my hope is that together we can consider how to make it all work. So you can give me a call in the pre-grant period so we can discuss how to best bring patients into your particular research, how that would work best, how to budget for patient partners or access to our research advisory councils. We'll talk more about those in a moment. I can support the creation of your own parent advisory group or train your research staff on best practices on working with families, whether that be parents, children, or youth. If you need focus group facilitation, I can help with that. Just one thing I want to focus on is if you really want to make sure you're touching base with your patient population before you even solidify your research question. So really early on in the research or in the start of the process, just to make sure that the outcomes will have true meaning in the lives of the families you are trying to help. A quote from Christy Whitmire, a researcher here at CRIM, but also works at the SSCY Center. "Working with Carrie and other parents has definitely made my work richer, more relevant, and more meaningful, as well as keeping it fun. Highlights have been working on Carrie on the 2 projects that she initiated, seeing where her and other parents' priorities are. I learn as much from seeing where priorities overlap as I do from engaging where they diverge." So, support number 2, our research advisory councils. So CRIM now has 2 research advisory councils. The RAC is a group of parents which are comprised of, from various perspectives who can support research. Not all of them have children with disabilities, but they represent a wide range of parents. And then the RACI is a group of youth aged 14 to 20. So both of these research advisory councils are available to do that patient engagement in your pre-grant period for free. So you can have one consultation for free just to check in about research questions or to check in about ideas, anything like that. A quote from Mandy Archibald, a CRIM researcher and from the U of M College of Nursing: "I am constantly amazed by the ingenuity of the stakeholders that I engage with. Recently, my academic colleagues and I were lamenting over the name of our new initiative, and within the span of 2 minutes, one of our youth partners offered us a response that was both out of the box and completely on point. This not only brought a smile to my face, but reminded me of why we do this work, the unique skills and creativity and perspective that our partners and the potential that they bring to the research cannot be overstated." Support number 3. Do you have a specific parent or youth or child that you want to bring into the research process before you have money to pay them? So CRIM can support you by paying up to 8 hours of that patient partner's time to support that grant submission. So now, pre-grant period done, grant goes in, and you wait. Maybe 2 months, maybe 4, and you get your money. So now we're off to the study setup phase. So during this phase, patient engagement, really, I can help you set up your own patient advisory group. You can get continued access to the RAC and the RACI, and we can plan for all that budgeting in the pre-grant phase. I can help train your research staff on best practices. And then basically you want to use these resources, the RAC and the RACI, your own patient, or another resource to really help make the documents you are creating to use in the study, that to make them work for the families that are going to be reading them. So they can help you create recruitment material. They can help you make sure your consent and assent forms are understandable and easy to read. So consent forms are usually for parents and assent forms are for kids to help them understand and to say that they actually agree to the study as well. You usually need both if you're enrolling children. You need a consent form and an assent form. And if your research involves interviews or surveys, for example, like the RAC, the RACI, or your own research advisory group can go over those questions and surveys just to make sure they are clear, understandable, and gonna get the information that you want. This is Chloe. She's a member of our RACI, and she has juvenile idiopathic arthritis. She has been and is still a participant in research. And in our conversation, she shared this quote. As a research participant, I have filled in surveys where if I read a question one way, I would have filled in a 1. If I read it another way, I would have filled in a 5 for the same question. It can be very confusing. So the goal of patient engagement at this stage is really to prevent any confusion and to make the experience of the participants in research the best it can be. A quote from the researcher from the Bright Coaching Program: for me, the main strengths of patient partners, or parent partners in this case, are helping to inform the methodological decisions so that the research component works for the families, creating a coaching program that is based on families' actual needs rather than what we think their needs are.
Thank you, Carrie. I can't echo that enough. The difference between a set of study documents that have had partners, patient partner eyes on them and they've been giving feedback, as opposed to those documents who haven't, are night and day. And that really affects the later stages of your research, because if it's incomprehensible to folks, they can't actually give assent or consent. So those supports are extremely important, and I would say are a crucial part of the feasibility of a study. But there are some other supports from the RSU during this stage. So I'm going to make a quick differentiation here. So there is what we call investigator-initiated research. So that is folks like yourselves, researchers coming up with these research questions and creating their own projects. There's also industry-initiated research. So those are companies who are testing new drugs for particular treatments or devices, vaccines, things like that. And those two different types of projects, so investigator-initiated and industry-initiated, can look very differently. So with it, let's say you are approached to do a industry-initiated study. So someone has come to you and there is a drug or a device that is going to be useful to your patient population, and the industry wants you to be a local site investigator. So they've already designed their project. They already have everything that they sort of need to think about in place. What they're going to do is a site selection visit. So they're going to meet with you, ask you a bunch of questions about the sort of the way your site operates, the sort of staff and experience you have, the equipment you have, that kind of thing, to ensure that the trial that they've designed is going to work at your site. So there's a ton of administrative work, and there's also, at the site selection visit, there can be questions that are daunting. So the research support unit can help you navigate that, that sort of environment. So we can take care of the administrative work with you. You can't just check out, we can't do it all for you. And we can also be present at the site selection visit with you and can be answering a lot of those questions on your behalf about what's available sort of through the RSU, what we know about being available through the hospital, and other supports like that. And that kind of support is free, right? You don't have any money for this trial because you've not been selected yet. So we offer that free. There's, of course, a lot of contracts with research, both industry and investigator initiated. There's local contracts between the researcher and the WRHA or shared health about accessing patient information. So that requires an agreement. There's also agreements with other sites. Let's say you've got the grant and you would like Winnipeg to be a site, and you all would also like some folks in Toronto, some folks in Vancouver to also be doing the same study. You're going to need contracts with them. Let's say you've got a colleague in Toronto and they want you to be a part of their project. You're also going to need a contract. And all of that can be very overwhelming and very confusing, a lot of back and forth. Not to say folks can't do that. It just is a little bit easier with some help. So we can absolutely help with the contracts process as well. And so again, it doesn't mean we're doing it on our own. It just means we are keeping an eye on where things are at. We are shepherding things through. We are translating the legalese for you, those kinds of things. We're just trying to remove those barriers that can be very overwhelming, especially if you're just getting into research. And we can support you in those ways. We also have awesome regulatory staff. And when I say regulatory, I mean sort of the regulations that govern how research happens. So here's some acronyms. The REB is the Research Ethics Board. They're governing, making sure that your research is being done in an ethical way. There's impact, which is referring to institutional impact. So be it at SSCY or in the hospital or another location in a community center, something like that. We're just making sure that the institution in which the research is happening is approving all that. They're good to go. You see HIPC there. HIPC is the Health Information and Privacy Committee. So if you're collecting particular pieces of information, you may need to apply to them for their approval. And CTA refers to Canadian trial application. Clinical trial application. And it's essentially when you are going to be using a drug or device outside of the way that it has been intended and already approved for. So we call that off-label. You have to apply to Health Canada with your study design and with your protocol and everything that you have designed to this point. And they'll say, yeah, I think you can do that. So that's quite the application. And what our staff can do is support those applications. So it's not that they have all of the expertise in your particular area to be able to complete the application entirely independently. That's not possible. There's information that you have as an expert in your field that's going to be necessary for those submissions. However, we have a pretty good basis of like what's acceptable and what isn't, how to do these things, particular language that needs to be in place. So our staff can really help with those submissions. We also know the order that those things need to happen in and the boxes that you need to check and that kind of stuff. So we can be helpful in that area. We can also help staff, whether it's our staff or if you have folks or you yourselves or other research staff who need to have access to particular data sources like electronic charting systems or things like that. We can help with that as well. We can also help with the document creation. So if you're not sure how to do a consent form or an assent form, something like that, we can give you sort of like here's what we would do, and then you can take it to your partners, they can review it, and we can try to meet somewhere in the middle, because to be honest, there's a lot of work that needs to be done with what a research ethics board will accept and the language that is accessible to all folks. So it's not necessarily going to be something you've provided to your patient partners, they've given you feedback, and then it can just go as is. But we can carry, and myself and the REB are working on that. And we can also help with staffing. So we have at the research support unit, a number of staff who can coordinate, who can be research assistants, who can be the regulatory experts for your project. But we can also help with you hiring your own staff if that's sort of where you're at in your research career. So if you need your own staff for research, or maybe they have a clinical role and you want to add some of the research pieces as well, I can definitely help get them trained up in what's necessary. That's sort of general research training. The training that's necessary for your project in particular should come from you because you're the expert. But I can help with those other pieces, and I can help with navigating the HR world. So fun. But those are some of the supports that we can offer in the setup phase as you're embarking on your research. All right. So with the exciting part, obviously, is the participant recruitment and the data collection, where all this work, the rubber is finally meeting the road. And so in this area, there is a lot that can be offered. So we can do the full spectrum. So we can do the full study management and coordination. So if you've got this awesome project and you don't have the staff for it, you can bring it to us. And if we have the staffing and the availability, we can take on the full management of your study. So that means we'll take care of everything. We can do the screening and consenting and enrolling of participants. So that means our staff are actually meeting with the potential participants and explaining the study to them and making sure that they understand what they're agreeing to do and to be a part of. We can do the visits and any follow-up. If you're testing a drug or device, we can do the dispensing and administration of the drug because we have research nurses who are trained for that. Sample collection, processing, storage, shipment, that kind of thing, we can absolutely do. Data collection, entry, any adverse events reporting. So with trials that are looking at drugs or devices, of course, there is a lot of requirements around safety and making sure that any adverse events are being reported and recorded in a risk appropriate way. So our staff have done this kind of work before, so they can be really great for those kinds of studies. We also have the study drug storage, shipping, any monitoring and auditing visits. So, you know, if your study is at high risk, then there's going to be monitoring. Someone's going to come check, make sure everything's going the way that it should be. And there's now a U of M auditor as well who's doing sort of similar checks, but not limited to high risk studies or anything like that. So we can absolutely help in all of those areas because research can be really daunting. But there's a lot of folks who may not have all of the time or the staff, and we're trying to be in that gap to make research easier for folks. So we have facilities as well. So let's say the research that you want to do, maybe SSCY isn't the setting for it, although SSCY is wonderful. Probably there are great settings there. But if you need to do your research elsewhere, we have examination rooms, we have meeting space, we have secure drug and sample storage in a fridge in a -30 and in a -80 freezer. We have some basic lab space for processing samples to get them ready for storage and then shipment off for final analysis somewhere else. We have a DEXA scanner, we have an ultrasound machine, we have blood pressure machines, all those basic instruments that you would need for your typical physical, essentially. So currently, in the projects that we're already doing, like I say, we have the industry and the investigator initiated trials. So sponsored just refers to who's taking ownership of the trial. So if it's an investigator or if it's industry, we have registries and repositories. We have observational trials, ranging from prenatal to preterm, all the way up to and including adults. You know, I said that we were pediatric focused, and mainly we are. But there are some studies that, you know, you want to watch that participant grow up into adulthood, and that longitudinal information is very important. So we support those. We recruit in Children's Emerge, in the NICU, in the PICU, in hospital clinics and wards, and also in the community, at SSCY potentially, and in other places. So we try to be as flexible as we can be in sort of the places that our staff can go and the work that they can do.
So where does patient engagement fit in this particular part? Well, there's a few different ways that patient engagement can look during the recruitment and data collection phase. So they can be consulted on where and how people might connect with the study. So where do you find those participants? New recruitment material as sort of you're getting feedback and getting participants. Sometimes there's new recruitment material. I know the Bright Coaching Program, one of the parent advisors actually created a little video about how they wished they'd had that, and that was used in recruitment. Patient partners may choose to share recruitment material, although not all patient partners will choose to do that. They can also help pilot any surveys and things like that, just to make sure that everything looks right once it's in the system that you're setting up or on the piece of paper that you're going to hand out, or help with any preliminary data analysis. They can also respond to issues that study staff are facing with recruitment and give feedback on why they think things are happening. So I want to talk just a little bit about eye care.
A study called Eye Care, which is really looking at kidney damage in youth that live with type 2 diabetes. And so we actually have a public and patient advisory group made up of kids and also caregivers who live with type 2 diabetes or care for someone who does. And that has been really interesting and important because prior to having that formal advisory group, the focus was primarily on biological risk factors like measuring A1C levels and high blood pressure or sugar levels, but it really goes beyond that when you're speaking to someone who lives with type 2 diabetes, and we've found that mental health and emotional support is such a key factor, and it's such a priority for our advisory group. And so they've actually changed the research approach, and they're using it's called a biopsychosocial approach. And they're starting to look at how risk factors such as stress can have an impact on kidney health in relation to type 2 diabetes. That wouldn't have been established without having an advisory group reminding us that that's such an important thing, not only.
So this is a research project that actually changed during the recruitment and data collection phase based on the lived experience of their advisory group. The researchers took what they heard and made it part of the project. Now, this project just received funding for Eye Care 2.0, so for another 5 years. Based on the feedback of the advisory group in the initial first 5 years study, the investigators are now adding a new area of research to the study. They are researching if a particular behavioral therapy intervention would be helpful to support the mental health of youth. So they took what they heard from the advisory group in Eye Care 1.0, they integrated into the initial study right away. They confirmed that it was a factor, so we now know, yes, that is a factor. And now in Eye Care 2.0, they are also studying if a particular method of mental health support works. So all of this was based on the feedback loop with the youth, caregivers, and community members with lived experience. So now you have the data, you move on to the analysis. So the RSU can help you connect with folks who can help you analyze that data if you do need it, if you need that support. And your partners can assist with things like coding of qualitative data and the interpreting of the results with lived experience. So back to Eye Care. So we are currently in the process of creating sort of an infographic for the end of the results of the study. And it shows photos of examples of how each one of the results of the study, what it actually means in the daily life of someone living with type 2 diabetes. So we didn't tell them what we think it means. We brought the data to them saying, these are the factors, and they shared what that means in their lives. So yes, that's partly interpreting results and partly about knowledge translation, like getting the word out there. But by coming to them to say, this is what we are seeing, what does that mean to you? We get a deeper understanding of what actually practically needs to change in their lives. And it gives us a better idea of who needs to see those results. Rachel, we're going to go over to you for post-study.
Yes. So post-study, there can be quite a gap between when you're done your recruitment and your data collection and your analysis to the knowledge translation and implementation stage. So we're in there to sort of fill in the gaps. There's a number of things that happen at the end of a study. So we're checking the data. We're closing things with the REB. We're closing your accounts and cleaning that up and making sure that any money that you're entitled to stays with you and your institution instead of going back to whatever source it came from, and archiving the documents and storing them. So we take care of that kind of thing.
And then patient engagement jumps in to help with sort of trying to get the knowledge out there. So how can you best do that? Is it a Facebook post, a video? How do you get it to the people so that you actually change practice, depending on, of course, what your results are? So really, they can help with plain language summaries or any of those tools that you're going to use to get the word out there.
Mm-hmm. And so the research support unit doesn't do absolutely everything, although I would like it to. We have a number of organizations that also provide services. So what we can do in the RSU is sort of help you make those connections to the different areas that might be useful to you. So CHI is the Center for Healthcare Innovation, and they have a lot of good supports for research as well. So they've got lots of database and statistical support. They can help with your protocol development and trial design. We work with the U of M Office of Research Services, as well as the Shared Health Department for Research and Innovation is what they're called now. And so each of those organizations have their own contracts and finance and different processes. So we work closely with those organizations to help make sure that your trial is going to run the way that you have designed it to run. And so we work with them closely, and we can help you get connected with the folks over there that might be essential for you to work well with. So some people's bottom line is cost. And so essentially we have two different costing models. So if you are doing your own project and you have been funded through a grant, you are investigator initiated research. So we just work on cost recovery. So there are a few staff members at the RSU where our services are for free. So like myself and our executive director and a few other folks, you don't pay us, CRIM does. Our other staff, so like our regulatory staff, our research coordinators, research assistants, research nurses, we just recover whatever time is spent on your trial. So that's the salaries and benefits portion that they actually spend. So if they spend 15 minutes, we actually only charge your study account 15 minutes. For industry funded trials, it's a separate fee structure. So it's a little bit more than cost recovery. And that's so when researchers come to us and say, I've got this great project, but I don't have any funding yet, we can sort of have those conversations and perhaps work something out. For people who are new to the RSU, so not necessarily new researchers, but who haven't used the RSU before, we can provide up to 10 free hours. Often those are sort of hours that are spent on regulatory submissions. And that's just a way for you to test out the RSU and see if you like us and for us to sort of get acquainted with the kind of work that you're doing. And then all researchers have 3 free hours of patient engagement support per study with Carrie. Carrie, did you want to expand on that?
Yeah, well, we've kind of already talked about pre-study, so I'm going to skip over this because we're almost at the end of our time. So I'm going to leave this up, but if there is any questions, now is the time. But